I know, that's why I went to thank you for joining us here this afternoon. We will be signing House Bill 916 concerning loan repayment for healthcare professionals. One of the biggest challenges in improving our quality of healthcare, especially in rural communities on the neighbor islands as well as here on Oahu, really is about finding the physicians and healthcare providers who are willing to provide services in these underserved areas. The ultimate goal of the bill is to encourage healthcare providers to work in rural and underserved areas by providing funding to help relieve their educational debt. There is an acute shortage of more than 500 physicians, doctors mostly, but other healthcare professionals in our rural areas that impacts the quality of services that we can provide. And this shortage is most acute in the neighbor islands and rural communities. This loan repayment program, which is administered by the Johnny Burns School of Medicine, is one of the fastest and least expensive methods of recruiting healthcare professionals to provide services in underserved areas. Since its inception in 2012, the program has helped 25 healthcare providers in Lanai, Molokai, Halawa Correctional Facility, and Waianae. All of the graduates of this program, 2/3 are still practicing in underserved areas in Hawaii. So certainly, program has been most effective. And with that, I'd like to introduce Virginia Pressler, Director of Health, to say a few words.
Thank you, Governor.
Yes.
And as the Governor has already said, we all know there's a shortage of primary care, particularly in our rural and underserved areas. And we're so pleased to see this bill pass because it's showing recognition of the importance of recruiting and retaining our primary care professionals in the areas where they're needed the most. And it's going to go a long ways to help meet the needs of those in the underserved areas of our communities. And I think Dr. Blanchett.
Dr. Blanchett.
Yeah.
Thank you so much.
Thank you.
On behalf of the John A. Burns School of Medicine, it's a pleasure to be given the opportunity to thank you, Governor, and to our legislators for passing this legislation. It's one thing to bring students into the medical school and to train them as they transition to become a physician. It's another thing to recruit and retain them to practice when they are burdened with educational debt. And so this way is a very actually clever and successful way of helping us do that, having us recruit our physicians and other healthcare workers to train in our beautiful neighbor islands. Thank you.
Thank you. Thank you. And we have Senator Josh Green, who, if I recall correctly, might have had some role in creation of this program a couple of years ago.
Thank you, Governor.
Yes.
I had a small role. It was a program that I participated in when I first came to Hawaii with the federal government, which is the National Health Service Corps. It paid my loans and it allowed me to work in Ka'u as a family practice doctor. A couple years ago, we modeled the state's program after that, and then the excellent work of the health committee chairs this year and the advocacy of the governor's team made this possible. So now we have our own program, our own homegrown program for young men and women who want to become doctors or nurses or psychologists to pay back their loans. It will make all the difference in our rural areas. So it was from experience, but really their hard work that made this happen.
Thank you.
Thank you,
Thank
Governor.
you. Please come forward and we'll sign the bill. You can stay up here, Josh. So House Bill 916, House Draft 1, Senate Draft 2, Conference Draft 1, relating to loan repayment program for healthcare professionals. Is now law in Hawaii as Act 58. Congratulations to all.
Thank you so much.
Thank you, Governor.
Thanks, Gov.
That's great.
Great.